Hey everyone, and welcome to the PTCB Prep Guide. Our whole goal here is to break down those tricky pharmacy concepts so they're super easy to understand and remember. We're going to get you ready to absolutely crush your exam. All right, so today we are diving deep into a really critical patient safety topic, therapeutic duplication. We're going to cover what it is, which drugs are super high risk, what your role as a tech is, how these things even happen, and then we'll wrap it all up with some practice for the exam. Let's get into it. Okay, first things first. Section 1. What is therapeutic duplication? Before you can spot it, you've got to know exactly what you're looking for, right? So, here's the deal. Think of therapeutic duplication as kind of sneaky overdose. It's when a patient ends up with two or more drugs that do the exact same thing. They might be from the same drug class or even have the same active ingredient, and it's all for the same condition. The bottom line, it dramatically increases their risk of an overdose, and that's a huge deal. Now, it is super important that you don't get this mixed up with a regular old drug-drug interaction. That's a totally different beast. A drug-drug interaction is when you have two different drugs that mess with how the other one works. But duplication, it's simpler. It's just getting too much of the same effect. Like taking two different meds that both thin the blood. It's an overload of one specific job. So how does this actually happen? Well, it usually pops up in one of two ways. The first one is pretty classic. A patient gets prescribed both the brand and generic of the exact same drug. Think atorvastatin and Lipitor. Same thing. The second way is a little trickier. It's when they're on two different drugs, but they're from the same class and do the exact same job, like omeprazole and pantoprazole. Both are proton pump inhibitors, both reduce stomach acid. See the problem? All right, moving on to Section 2. This is where we get into why this is such a critical safety issue. We're going to talk about the high-risk drugs and the very real dangers involved. This is stuff you absolutely have to know, not just for the exam, but for your entire career. Okay, everyone, lean in for this one. This is must-know territory for the PTCB exam. The drug classes we're about to cover are the ones that pose the biggest risks, and because of that, they show up on the test all the time. They're high yield for a reason. So let's break down these dangers. Look at opioids, right? You double up on something like oxycodone and hydrocodone, and you're risking respiratory depression. That means they could literally stop breathing. Then you've got anticoagulants, or blood thinners, like warfarin and rivaroxaban, which is Xarelto. Too much of that, you're looking at a major risk for serious bleeding. How about benzodiazepines? Think alprazolam, aka Xanax, and lorazepam, aka Ativan. Taking both can lead to dangerous oversedation. And finally, SSRIs. These are common antidepressants. Doubling up here can cause something called serotonin syndrome, which is absolutely life-threatening. Okay, Section 3. This is all about you. So what happens when that alert flashes on your computer screen? What is your number one responsibility? Let me tell you, it's simple and it is 100% non-negotiable. I want you to burn this 3-step action plan into your brain. Step 1, you see the warning. You identify the potential duplication. Step 2, stop immediately. Don't count the pills, don't slap a label on it, don't even think about bagging it, just stop. Step 3, alert the pharmacist. That's it. You hand it off for their clinical review. Simple as that. This right here, this is a high-yield quote for your exam. I want you to memorize it. Your job is not to play detective. It's not to guess why it's happening or to override the warning. No way. Your one and only move is to flag that prescription and get it to the pharmacist, period. All right, let's move into Section 4. So how do these things even happen in the first place? If we can understand the common causes, we can be way better at preventing them. A lot of times, it really just boils down to a breakdown in communication. A patient sees their family doctor and a specialist, and the two offices aren't on the same page. Or you see that classic brand name versus generic confusion we talked about. Sometimes a doctor starts a new medicine without telling the patient to stop the old one. And a huge one is overlap with over-the-counter stuff. A patient grabs some Alli for a headache, not realizing the prescription anti-inflammatory they're already taking is basically a superpowered version of the same thing. So, what's our main defense against this? Well, there's a huge safeguard built right into how pharmacies work. And it all comes from a major piece of federal law. And that law is OBRA 90. You're going to want to remember that name. It legally requires something called a drug utilization review, or DUR for short. This is that mandatory safety check the pharmacist does. And this is where you come in again. Your job of entering prescription info accurately is what powers the whole system. If you enter it right, the computer can flag these problems for the pharmacist. You're the first line of defense.
Okay, section 5, it's time to put what you've learned to the test. We've gone over the what, the why, and the how. Now let's see it in action with a practice question that's just like what you'll see on The Real Deal.
All right, check out this scenario. Your patient's profile shows they're already taking citalopram, that's Lexa. Then a new script comes through for escitalopram, which is Lexapro. So, what do? What's your very first move? If you thought alert the pharmacist immediately, you nailed it. That is absolutely the right answer. Why? Because both of those drugs are SSRIs. Even though they're not the exact same chemical, they work in the exact same way. Taking them together puts the patient at high risk for that nasty serotonin syndrome we talked about. This is a total classic PTCB question, so lock it in. Okay, let's do a quick-fire recap to make sure this all sticks. What is it? Same class, same ingredient, same problem. What's your action? Always stop and alert the pharmacist. What are the high-risk classes you need to memorize? Opioids, anticoagulants, benzodiazepines, NSAIDs, and SSRIs. And what's the key law? OBRA 90, which mandates that DUR. Got it? Good. Awesome job today, everyone. You've totally got a handle on therapeutic duplication now. You are absolutely on the right track to passing your PTCB exam. Make sure you review your notes, rewatch this if you need a refresher, and keep practicing those drug names every single day. If this explainer helps you out, do me a favor and hit like, subscribe, and share it so we can help more people. We're putting out new simplified pharmacy topics all the time to make this whole process easier for you. Keep up the great work. You've got this.